All right, welcome to The Explainer. Today we're going to break down neurogenic thoracic outlet syndrome, or nTOS for short. Now, this is a condition that's a notorious medical puzzle, even for seasoned doctors. So what exactly makes it so tough to pin down? Let's get into it.
Okay, so think about it this way. Let's say you've got some numbness in your hand. A doctor might immediately think, okay, maybe a pinched nerve in the wrist or something in the neck, but with nTOS, the symptoms just don't follow that neat little map. You might feel pain in your shoulder, weakness down your arm, and weird tingling sensations in your fingers, kind of all at once. It's this lack of a clear, specific pattern that makes it such a medical mystery.
So what does this disabling pain really feel like in everyday life? Let's take a closer look at what people who live with this are actually going through. Seriously, just picture this. Simple, everyday things like reaching for something on a high shelf, typing at your desk, or even just sleeping with your arm overhead suddenly trigger this debilitating pain, this numbness or weakness. This is the reality for people with nTOS, and it most often affects women who are really in the prime of their lives.
Now, to really get why this is happening, we've got to look at the anatomy. The root of the problem isn't actually in the arm or the hand. It's in a surprisingly small and incredibly crowded little passageway up in the shoulder area. And this is the spot we're interested in, the thoracic outlet. It's not one single thing you can point to, it's more like a region, a really tight corridor that literally everything your arm needs has to pass through.
Honestly, the best way to visualize this is as a massive neurological traffic jam. You've got this super highway of nerves, that's the brachial plexus, plus the main artery and vein for the whole arm, all trying to squeeze through this narrow path. It's bordered by the scalene muscles on the sides and the first rib down below. When that intersection gets too crowded, well, that's when you get compression.
So, what causes this traffic jam in the first place? Well, sometimes it's just the anatomy you were born with. Some people have an extra rib up there, called a cervical rib, that can really narrow the space. Other times, it's the result of an injury, like if you break your first rib and it heals with a big callus. Or it can come from the repetitive strain of certain jobs or sports that just constantly irritates those surrounding muscles. Now, these factors don't always cause nTOS on their own, but they sure do lower the bar for symptoms to pop up.
So you can see how this all adds up, right? With tricky anatomy and these really vague symptoms, diagnosing this thing is, well, it's basically detective work. There is no single smoking gun.
And this is the million-dollar question for doctors. If there's no blood test, no single scan that can definitively say, yep, this is nTOS, how in the world do you get to an answer? The solution is a process of really careful exclusion and recognizing the patterns.
So the first thing they have to do is rule out the usual suspects. For instance, is it carpal tunnel syndrome? That affects a very specific nerve in the wrist. Or, hey, could it be a disc issue in the neck? With that, raising the arm might actually make things feel better, which is the exact opposite of what happens with nTOS.
Now, one of the most revealing physical exams is this thing called the East maneuver. The patient holds their arms up, kind of in a stick-em-up position, and then they just open and close their fists for 3 minutes. A healthy person can do this no problem, but for someone with significant nTOS, this position brings on their symptoms so intensely that they often have to stop in under a minute. It's a huge clue.
See? A diagnosis isn't about one single clue. It's about piecing together a whole bunch of them. So when a patient shows up with the right kind of widespread symptoms, specific triggers like raising their arms, a history of some kind of trauma, and then they have positive results on these physical exams, that's when the clinical picture of nTOS starts to become really clear.
So, once that diagnosis is looking pretty solid, the first move isn't what you might think. It's not surgery, it's not medication, it's a very specialized kind of physical therapy.
The whole goal here is pretty straightforward. Create more space in that crowded thoracic outlet. Therapists work on correcting posture, stretching out those tight muscles that are causing the compression, and then strengthening the supporting muscles in the back and shoulder to hold everything in a better, more open position. It's all about taking stress off those nerves.
But, and this is a big but, physical therapy isn't always the final answer. For patients with really severe symptoms, especially the ones who end up at specialized centers, only about 20 to 30% find lasting relief with just therapy alone. For everybody else, it's time to start thinking about the next option.
So for those folks, the next step is a big one: surgery. It's designed to physically go in there, create more space, and decompress those nerves. And when it comes to the surgery, there are basically two main routes a surgeon can take.
The transaxillary approach goes in through the armpit, the scar is hidden, which is nice, but it gives a surgeon a more limited view. Then there's the supraclavicular approach, from above the collarbone. This gives a surgeon a really clear, wide-open view of the whole area, which lets them do a more thorough job decompressing everything.
Okay, so a major surgery like this, it obviously brings up the biggest question of all. Does it actually work? And what is recovery really like?
And the results? Honestly, they're pretty compelling. In a huge study of over 3,800 surgeries, the outcomes for patients who were carefully selected are overwhelmingly positive. About 80% of them report a good outcome, which means their major debilitating symptoms were relieved. But, of course, no surgery is ever totally risk-free. One of the known complications, especially with that supraclavicular approach, is temporary irritation of the phrenic nerve. That's the nerve that controls your diaphragm for breathing. It happens in about 10% of cases and can cause some temporary shortness of breath, but it almost always gets better on its own over time. And this is really important to remember. Surgery isn't some magic wand. It's really the beginning of the next phase of recovery. Physical therapy after the operation is absolutely critical to get your function back. And, if a nerve has been squished for a very long time, some of that numbness or those weird sensations can stick around, even after a technically perfect surgery.
When you look at the whole picture, the frustrating search for answers, the complex diagnoses, the intense treatments, it really highlights something crucial. It's not just about finding a skilled doctor or surgeon, it's about having a supportive, team-based approach to guide patients through every single step of what can be a very, very challenging path.